Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And today, I want to answer one of the most burning questions that I have. What's it like when your business gets acquired by CVS Health for $8 billion? Here to tell us all about it is the CEO of Signify Health, Kyle Armbrester. Kyle, congratulations.
Hey, Jess. Thank you very much.
I cannot believe how quickly this has happened, really, here. I mean, the acquisition just closed, but I mean, I'm looking at you with that background, and I'm reminded of when Signify went public, like not very many years ago. You were sitting in the same place, and here you are now. So, all right, before we get any further, I want to make sure everybody understands exactly what it is that CVS Health has just bought. So, Kyle, tell us really high level, what does Signify Health do, and what market does this put CVS Health in?
Yeah, absolutely. Signify is a large, diversified, payer agnostic business, and we are focused on enabling and scaling value-based care with our partners. And so what does that all mean? We serve a broad array of payer clients, large national payers all the way down to small regional folks. We also serve at-risk health systems who are operating as a de facto payer in some risk contracts. So we predominantly do that through our ACO book of business. And all of our business model is an aligned incentive business model. So we only do well when our clients and patients are doing well ultimately in everything that we do. Our two kind of main business lines are one, we go into millions of homes annually. We'll be just shy of 3 million homes this year in every county of the United States. And we have over 200 health system partners in 40 states in those ACO contracts that I mentioned as well. And what did CVS buy? CVS is interested in building a large multi-payer independent segment inside of its broad, portfolio of assets. So Aetna is still a customer of ours. We operate arm's length from Aetna, and we're going to keep our whole client base, and we're thrilled about that. And many of our clients are thrilled about our roadmap and what we're going to be bringing to market as well as a part of this acquisition.
Okay, I'm going to come back to all of this payer agnostic stuff because it's not like me to just let that go. But before we do that, I want to talk about home care a little bit because I think that's one of the interesting facets of this deal is that this takes CVS Health and puts the retailer in the home in a brand new way. So talk to me about home care because I think a lot of people have a misconception that it's like, oh, it's just hospice, it's end of life care, it's something for not everybody. But really, home care has changed a lot. It's much more preventative. You guys are doing medication reviews. It's there to close care gaps. Tell me a little bit about how home care has changed, what it really means today, and like what your teams on the ground who do these millions of visits in the home a year, what are they doing?
Yeah, you're absolutely right. It's turned into a big preventative screening tool and not a reactive tool like so much of the fee-for-service world that has plagued us, frankly, for the better part of a generation. When we go into the home, we're going in with a pretty broad toolkit. We're bringing in connected devices. We're doing screening tests. We're assessing social determinants of health behavior. We're spending a ton of time returning folks back to care. So if we go into a senior female's home and she hasn't had a mammogram, we help reach out to that specialist, get that booked, and make sure she can get to that appointment. So it's really taking prevention and engagement and pushing it to the next level. To me, the best way to think about it, when we first announced the deal, the CEO of CVS, Karen Lynch, called it a home care renaissance. And that's genuinely what I believe is happening. If you look back to the 50s, home care was and house calls from doctors were pretty prevalent in this country. And then we moved into a very facility-centric point of the view where there was consolidation and all healthcare had to happen in between four walls. I think CVS doing this deal is an acknowledgement that healthcare is being executed across a continuum. And while the retail segment is a vital part of that continuum, our hospital clients are a vital part of that continuum, the home is also something that's been overlooked for quite some time. And so I believe people want preventative care there. They want to recover there. And I think they recover more quickly there as well. And so we've seen just unparalleled demand for our services. Every senior that we go see, every Medicaid individual that we go see opts into our service, right? So they're making a choice to allow us, into their lives. And we have a really trusted moment when we go into that home where we're making a tremendous impact on these millions of lives that we have the honor of engaging with each and every year.
Market standpoint, say a little bit too about where home care is starting to go in terms of the whole the sum total of the care delivery spectrum. I feel like so much has changed in terms of like where primary care is, where the hospital is at. Home care is filling in a bunch of gaps. And I'm curious on the market side of it, what are some of the key, incentives or Medicare policies or things like that that are really driving this? Because I think there's a lot of exciting stuff kind of headed down the pipe this way.
Yeah, I would say it's two things. One, from a macro market perspective, I think there's a realization that care should start and finish in the home, right? And so if you can get in a preventative manner and engage with someone before they show up in the emergency room or before they have a accident or a diagnostic test that should have been performed, you can have them they will have a much better healthcare journey, number one. And two, you can just remove an inordinate amount of waste and cost that's plaguing Medicare and all taxpayers that fund into it. So I think that's number one. Number two is, after that discharge moment, we as a country have become far too dependent on post-acute facilities to be a primary means for discharge, when many of those activities could and should happen inside the home. Many of those post-acute facilities do have a place, but I think overwhelmingly, as devices have shrank, remote patient monitoring, and the ability for companies like ours to go into these homes, you're going to see, and we are seeing, more and more seniors want to recover and spend time there. On the reimbursement side, I think that the move towards total cost of care, and so pushing down a delegated risk where you're assuming full responsibility for an individual's life from a cost standpoint, it's forcing organizations to stop old bad habits that were focused on utilization and just keeping beds full, and looking at a comprehensive continuum of care to see when is the best place, where is the best place to actually engage with somebody. And I think those two things have been, macro shifts. So starting and stopping in the home and total cost kind of reimbursement models we've been big benefactors of, and something that we're pushing, more and more into market as well.
Let's talk a little bit more about that, because you, to me, have like such a reputation, and I think Signify, as a result of your leadership of it, as being, very, very payment model innovation focused. Like if I know one question to ask you in an interview, it's about payment model innovation, because I know you always get fired up for me, Kyle. So, thinking about this deal, actually thinking about taking Signify Health, which has really been a success story of value-based care, and scaling it, which is always, value-based care can't be scaled. That's always been a big criticism. And then adding to that, the side of the business you mentioned, working with ACOs. I remember your acquisition of Caravan a couple of years back. So you guys have really proven the success of those models in a big way. What does this deal mean for the future of value-based care and its scalability, particularly because it's CVS Health that acquired your business, and CVS Health is literally, if not one of the most vertically integrated healthcare organizations in this country? What does this do for payment model innovation?
Yeah, I think it comes down to one simple word. And I tell my team about this word all the time for our internal work. I talk about it with our clients. It's alignment. And to me, for value-based care models to work, if you have a tech-enabled service partner like Signify, you cannot make money unless patients are having better health outcomes and you're removing waste from the system. And if you have a business model like PMPM or a license maintenance model that is divorced from results, it's not going to scale, in my opinion. And I think a big thing that CVS got excited about with us was that alignment, was our extremely high net promoter score in both a health plan client base and a provider group client base. And again, I think that all comes down to that aligned business model.
All right, let's talk about that payor agnostic phrase that I promised we'd come back to, because I think this is the perfect time. How does that fit in here? Because obviously, you're thinking about that, and you're thinking about the alignment and the vertical integration. Okay, so still though, you've got a network of providers and a network of plans that you work with. Explain how payor agnostic comes to life in the market, Kyle.
I believe you have to be payor agnostic to be successful, and I'll explain why. Provider groups in particular, hospitals, health systems, independent groups, they're inundated from the health plans and the federal government on risk and quality and all of these other programs. It's very hard for them to manage, right? A Humana program is not the same as a United program, is not the same as an Aetna program. You need a third party like Signify to help smooth some of that out, so doctors can focus on being doctors and we can take the administrative burden away from them. And so to be payor agnostic, to me, is twofold. One, it's treating all payer customers as equals, which is core to our kind of mission and what we're going to continue to do as a part of the CVS family. But number two, it's normalizing some of their own programs to drive better adherence, better adoption, better patient outcomes through a scaled service offering that connects the payers and the providers in a unified way. And I think Signify is uniquely positioned to help accomplish that. And so just to reiterate it again, our Aetna account team, which is one of our rockstar account teams, still exists. We still have a counterpart inside of the Aetna business unit. And so we're operating at arm's length. We're not being integrated into Aetna. We're a standalone independent entity inside CVS that's going to continue to enjoy our multi-payer and multi-provider client base.
All right, talk about the tech that you guys are running on, because this was another thing that I read that Karen Lynch had said was that technology is really the enabler for bringing CVS into the home. So say a little bit about the tech that Signify Health is built on, because I think people forget that you guys really have a strong technology component behind you. This isn't just a service business.
Yeah. Look, we spend over $100 million a year in research and development, and we have a global team that's, US based, Ireland based, and we're scaling an India based team. And so, and we don't do that for cost reasons. We do that because I believe healthcare doesn't sleep, and folks working on technology and data shouldn't sleep either. And so we want to constantly be working on our patients' data to make sure that we're driving better outcomes. The three things I think that we do that are differentiated: one, we ingest a lot of payer and provider data and send it back to payers and providers, but have a massive analytics and data management engine in between that. So we're helping to prioritize and making sure that we drive efficiency in how we're engaging and touching all of those patients and individuals' lives each and every day. Second, think of us as a FedEx or a UPS operation system. We are managing thousands of providers in the field each and every day to get to those almost 3 million homes. And on the ACO side, getting providers and our care teams out into those ACOs, there is a tremendous amount of drive time, logistics and routing, shipping of devices and iPads that goes on behind the scenes here. And so one of our largest teams has nothing to do with healthcare. It has to do with efficiently delivering services out into the market. And then the final thing that I am super proud of is we have a really great clinical data engine inside of us. And it's really good at capturing information when we're in the home, capturing information with our facility partners in the ACO, and then bringing that back and helping to return those folks to care, triage them, and ensure they're getting the care that they need. And when you bring all of those things together, I mean, our technology team is one of our kind of core assets that differentiates us as a business. And it's clear to me after my first few weeks here at CVS that they intend on growing and investing more in that. I think that's what Karen meant by her statement, to continue to amplify our ability to touch other parts of the payer delivery cycle.
God, I'm really personally excited about that, not just for Signify and CVS Health, but for the rest of us who have to, suffer with, healthcare data systems that don't quite talk to each other. So it'll be exciting to see how this challenge gets resolved at this level. I want to ask you, you mentioned, Signify Health, or Signify Health, CVS Health, you've been there for, a couple of weeks now, but, I'm wondering if we can pick your brain as like an insider here and maybe get some gossip from you, Kyle. Like, they've acquired something else. They've acquired Oak Street Health. And I know that hasn't closed yet, but let's just, say everything goes just as smoothly as the acquisition of Signify does. Have you heard anything about how perhaps, Signify and Oak Street Health might be integrated within, the big mothership CVS Health company?
Yeah, they're building out a healthcare delivery organization. And so Signify and Oak Street will sit inside that organization. And, their goal for both of us is pretty straightforward. They want us to be independent businesses that continue to be payer agnostic. And they're doing a very hands-off integration approach. And they're giving us a lot of autonomy to continue to grow our product roadmaps. Every conversation with the CVS team is, how can we help you? How can we move faster? How can we see more individuals? How can we do right by the rest of your clients? It's been really refreshing, frankly, and everything that I've seen with how they're in the process of trying to close the deal here in the next month or so. They're excited about doing the same thing, with Oak Street and supporting them, providing more, funding for roadmap, and then I think taking a bigger step back and thinking of other acquisitions and partnerships that we can be making as a part of this organization in the future as well.
What's a focus on the senior market here? Medicare Advantage space. Yeah.
Yeah, a lot of Medicare. I mean, we're in hundreds of thousands of Medicaid homes now too. And so we've diversified tremendously since the IPO. And that's just, there's a lot of demand for our service, and it's bridging into other populations. I think Medicare is a great population to start with, but our ambitions, and I think the ambitions of the healthcare delivery org, are Medicare, Medicaid, and commercial, right? So all populations over time.
That's awesome. All right. I heard, you're talking about having the backing of this big company and that it's going to turbocharge your roadmap. So tell us what's next for Signify Health. I mean, and it's so funny, Kyle, I have to say, you've been CEO, I think you just celebrated 5 years of being CEO of Signify Health. And I feel like I've spoken to you so many times at different milestones, acquisition of Caravan. I mean, different types of things that you were doing with your clients, your IPO. I mean, here you are now, and it's I'm kind of thinking to myself, how much more turbocharged could this roadmap be? But give me some insight. Tell us what's on the roadmap and where you're headed next.
Yeah, I would say it's a few things. So one, CVS has the best healthcare brand in the country, right? And so how can we leverage that brand to touch more people's lives, do more in the home, do more inside of our hospitals, so offer more services to, again, take administrative burden off from folks. So I'm super excited about that. Number two, if I say CVS, one of the first things that pops in your mind is pharmacy, right? And we have no pharmacy assets to date. We spend a lot of time in the home helping seniors think about their meds and organizing them. But I would love and can't wait to dive in more on cost programs, drug adherence programs, med-unmed interaction programs, doing that with CVS and doing that with others kind of out in the market as well, right? Again, we always want to be agnostic and neutral when we're building these services out for the individuals' lives that we touch. I think there's a tremendous ability to really lift up the human condition if we connect all those dots.
Awesome. Well, Kyle, congratulations to you and to the Signify Health team. It's an awesome acquisition. I mean, I'm really excited for everybody involved here, Signify Health and CVS Health. So thank you so much for stopping by, letting us know, what's going on, letting me pick your brain, particularly about payor agnostic and what that really means. Appreciate that. We'll have to have you back when you get, a little bit more settled in, maybe after the Oak Street Health, fingers crossed closes, but we'll see, right? And I look forward to talking to you again. Thank you so much for stopping by and catching us up. I feel like, again, I have to thank you for stopping by at every major milestone.
Absolutely, Jess. We appreciate the support. Thank you very much.
All right. Thank you. I'm Jessica DeMassa. That's Kyle Armbrester. He's the CEO of Signify Health. You're meeting him maybe for the first time as part of his company's big news on closing their deal with CVS Health to be acquired for $8 billion. And for more interviews with those who are changing the way we do healthcare, head on over to my YouTube channel. It's youtube.com/WTF Health. Again, we'll talk to you guys soon. Kyle, thank you so much. Congratulations.
Thank you.
Bye.
Bye-bye.